Hi, I'm Dr. Group, and thanks for your question. This question is from Robert, and Robert has severe tightening of his joints, basically arthritic symptoms. He's not even able to close his fingers, and especially his fingers cramp up at night. So if you're dealing with any type of joint issue, or if you're dealing with arthritic conditions, there's two different types of arthritic conditions. Well, there's a lot of different types of arthritic conditions, but two common ones, which is osteoarthritis, and which is just a common arthritis found of the drying up of the joints. And what happens is you start losing your cartilage in your joints, and those become painful. And then there's rheumatoid arthritis, which is more of a hereditary type arthritis, which causes really bad alterations in the bone and structures in the hands, and is still extremely painful. What I think we're dealing with here is more of just a standard arthritis, although there's many different forms of arthritis, so it's hard for me to determine what type of arthritis it is. But let's just address the issue of painful, stiff joints. You know, those are the symptoms, the beginning symptoms of arthritis. What causes painful stiffness joints? Well, we have the number one thing that causes pain and stiffness is a lack of minerals in the body, most likely potassium, calcium, and magnesium. Now, some people say, hey, I'm getting enough calcium, I'm getting calcium through the milk that I drink, blah, blah, blah. Most people aren't getting enough calcium because they're not taking the right, proper form of calcium inside their system. So let me run down a few things that help lubricate and produce the synovial fluid, which keeps the joints loose and active. If your cells cannot produce synovial fluid to keep that oil in there, then the bones will rub against each other, the cartilage in your joints will start to decay, and you'll start getting an inflammation response. Also, anytime you have arthritis means you have too many toxins in your body, and your body is picking your joints to dump the toxins in. When the body dumps the toxins in your joint tissues, it might start with one finger, move to another finger. It might start in the knee, the hip, the ankle, the hands, the wrists, the elbows, the shoulders. The body determines where it's going to dump those toxins. When the toxins coat the cells in the joints that produce, these are called chondrocytes, and the chondrocytes secrete synovial fluid. When you have toxins surrounding the cells, the synovial fluid can actually dry up and cause the joints to degrade. So, Randy, what I would do if I had arthritis like this, or I had this condition, the first thing I would do is go back to my cleansing, cleanse the intestines, do about 3 liver and gallbladder cleanses, cleanse the harmful organisms, because they now associate a bacteria with arthritic changes in the joints. So I would make sure that I get my harmful organism cleanse done, and then I would proceed with a toxin and heavy metal cleanse. Now, good supplementation to use is a lot of fresh, clean, pure water with organic apple cider vinegar. I use a product called Nutria Cool, which I personally developed based on Dr. Nieper's success rates using calcium orotate and magnesium orotate. What I would also do is I would use a calcium AEP, which is a calcium amino ethyl phosphate product, which is extremely effective. Another really effective all-natural product I would use would be Nutria Cool. I developed this product because there wasn't any pain-relieving products on the market that you could put on your wrist or anything when I was seeing treating a lot of individuals with sports-based injuries that would seep deep down into the joint and would actually start help healing the joint. So by applying the Nutria Cool 3 or 4 times a day and keeping that soaked and really working it in, you should notice tremendous relief. But again, we're going back to why you have that to begin with, which is what you need to do is just cleanse your system. So things you can take: MSM, DMSO, applied to the skin, to the joint. Nutria Cool, magnesium orotate, calcium orotate, and calcium AEP. And even if you want to supplement some MSM with that, MSM works great for the joints. Thanks, Randy.